Hi everyone, today we're honored to invite Dr. Alan Green to share his medical practices and knowledge with us. Dr. Green is a renowned pathologist in New York. He has translated large amounts of scientific research on anti-aging and life extension and put it to work on humans. To our knowledge, he's a true pioneer in the clinical use of rapamycin to fight against aging himself and in the practices for more than 1,000 patients. Thank you so much for joining us today. So it's so good to see you. Now, if you don't mind, now shall we start this interview? Well, my first question is our readers are wondering that when you first started to take rapamycin for apical hypertrophic cardiomyopathy, you are not so sure that it will work, right? So, as a doctor, why did you choose rapamycin instead of other medical treatment?
My cardiovascular system was deteriorating very, very rapidly. And so I was in but I thought I was suffering from aging. At the time, I hadn't sort of like, I had it like I wasn't in clinical practice. I didn't know what sort of, I was getting very, quite short of breath with like a small degree of walking or any degree of walking up hills. I thought my sort of like medical, I thought my con- uh, cardiovascular system was deteriorating very, very rapidly. And so I was in but I thought I was suffering from aging. At the time, I hadn't sort of like, I had it like I wasn't in clinical practice. I didn't know what sort of like what aging, I didn't really know what aging looked like since I was in my early 70s. And I'm all I knew, I was in my early 70s and I was going downhill very rapidly. That was really all I knew. I just assumed that, oh, I must be suffering from aging.
Well,
Then,
that's the first time that you're realizing what is
yeah,
the feeling of being.
we're right. So before that, I never thought about aging whatsoever. I sort of like, in other words, so I had never thought about aging. Aging isn't anything that's considered as a medical thing. And so I hadn't thought about aging. And now when I sort of like see that, well, you're going, then I see, oh, I'm going downhill, which proved sooner than I had expected. This is very surprising how fast I'm going, like declining, how rapidly I'm declining. So I say, well, this must be due to aging. Let me sort of like figure out what I could do about like aging. Then I sort of like came across the only sort of, so then I began studying like aging. The only thing available that I discovered that made any sense was the idea of like Black's idea about rapamycin. So I decided, well, maybe I would try that. At the time, I had very little expectations that it was going to work actually. I sort of like, so I had very little expectations there was work. I was very like, but I just decided, well, that was the only sort of like thing that was available for treating aging. And I just decided, let me see if it worked. I had little expectation that it was going to work. It was only after sort of, and then I just sort of like, from like the work that was available, I like figured out that like a good dose should be 6 milligrams once a week, just by sort of like some of this, a lot of the stuff that was out there. So then I decided to sort of like try that. Then by around like 3 or 4 months, I was just blown away by how well it was working. I just cannot believe how incredibly great that I was doing, that I was just doing remarkably well. And I noticed it's sort of like not only did I have a lot much improvement of cardiovascular function, I had all sorts of other things I was doing very well. I was extraordinarily happy with how I was doing. It wasn't until about 3 years later that I had an opportunity to have an echocardiogram. When I had an echocardiogram 3 years later, I found out, oh, you weren't suffering from aging, you were suffering from this other cardiomyopathy. And then I realized, oh yeah, that's what killed my mother. That's what killed my grandmother. That's why I wasn't having a lot of any old people on my mother's side of the family. I just realized in retrospect, oh yeah, that's what you had. But it just sort of So it just turned out that rapamycin worked very, very good for that because that's sort of like it's the genetic disorder, but it has a final common pathway involving fibrosis and hypertrophy, and rapamycin kind of blocks that. So rapamycin had a very good clinical effect, although it did sort of like create the anatomic changes that had been present. I should have started it 30 years sooner.
Well, I'd heard from your public interviews that your practice is largely based upon the theory developed by Dr. Flagel-Tony that mTOR is driving aging. So my question is, to what extent do you think his theory has shaped your practice?
Yeah, initially the theory was based 100% on Black-Scholar's ideas because
100%.
when I initially started, my totally knowledge was zero, and Black-Scholar is sort of like had very, very good ideas. So initially it was based 100% on his ideas, and I read all his papers and so forth. At this point, the only sort of like the difference is uh, Blackus Clonis came up with the idea that mTOR was like pushing aging and just causing aging by like hyperfunction. That idea, I like that idea. However, what I don't agree with about Blackus Clonis is Blackus Clonis came up with the idea that he called it a quasi program. I don't think it's in other words, so I don't think it's what as a quasi program. I think it's a real program. In other words, but that was basically a matter of theory. So the theory of why it would be working, say I would be in complete disagreement with Black's clothing of the theory of why it's working. But the idea that that is working due that mTOR is causing hyperfunction, and hyperfunction is accelerating all the age-related diseases. That I agree with. So it's the idea. So that idea was a very, very brilliant idea. But the difference is to sort of like understand the difference between a quasi program and a real program. That's sort of like to me of extreme importance to understand the idea of aging. And that I would say, and so to basically understand aging, so like to understand why rapamycin works, it's real important
Yeah.
to understand aging. And the idea about aging is something that developed because it turned out to be extraordinarily beneficial. But it was extraordinarily beneficial not for the aging animals. It was extraordinarily beneficial from the point of view of projecting hundreds hundreds and thousands of generations into the future. It was extraordinarily beneficial for the point of developing genetic variations which would allow an animal to better evolve and cope with the changing world. That was the idea of aging. So aging was basically similar to like a rather sort of like a mathematical, like an elegant mathematical model of improved genetic mutations. And so
Cycle.
so that was the idea. Well, the idea is that the underlying thing is that in order to so you have aging developed to sort of like promote the genetic sort of like improvement of the different species. Now, once you have aging, you have to have a program causing it. And at the time this is developing, mTOR just increased its portfolio. In other words, mTOR had been available around for 2 billion years. mTOR had been the major, had evolved over 2 billion years to be present in all the sort of like animals more advanced than the bacteria. So if it was like anything with the nucleus, all these animals in the plant world, the animal world, they were using mTOR as the major command and control of the cell for 2 billion years. Now, now mTOR just increases its portfolio. To understand it, you'd have to sort of like go back 200 million to 200 million years ago. If you go back 200 million years ago, and basically is the idea that animals can sort of like this, like figure out whether they want to age fast or whether they want to age slow, depending upon what fits in best with them. Now, if you have something like an Arctic clam, an Arctic clam wants to age very, very slowly. It lives 500 years. They figured out that, so they sort of developed all sorts of modifications to age very slowly. Now,
Well, that is the first time that I hear about this. So humanitarian or so historic opinion on aging.
right. So
Then shall we go back to practice itself?
no, it's really important to understand what aging is, to understand how rapamycin is going to treat aging. So the idea is this takes a few minutes to understand it. To understand, because the idea of like aging is the aging sort of like ideas have been just totally raw. In other words, they sort of like and basically the aging idea started about 1859 with sort of like Darwin. Now you sort of like, and now Darwin has a very, very good idea. Darwin and Russell, they introduced the idea that for a trait to be inherited, it has to be beneficial.
Yeah.
That's the fundamental idea in biology. That, like, in other words, you're not going to sort of like to develop a trait if it's not beneficial. Well, the problem was things like claws and things like that. It was easy to understand why a claw or a teeth could be beneficial. It wasn't so easy to understand how aging was beneficial, especially if you looked at aging, especially if the person looking at aging was like an old person and figures out, wow, this aging doesn't seem like a really good thing. It's causing me to be sort of like getting old and so forth. Anyway, so the idea is that they couldn't figure out why aging was beneficial. Now around sort of like 1920, they developed one of the all-time worst ideas in biology. And one of the all-time worst ideas in biology, they called evolutionary theory. And what the evolutionary theory was that aging didn't have any adaptive value. Therefore, no genes could evolve that promote aging. Therefore, aging is just something that takes place without being controlled with genes. Therefore, aging is basically being controlled by just the same physical and chemical principles that are the same for inanimate objects. That aging in a human is the same as like aging in a car. It's just a sort of like deterioration. They call this idea evolutionary theory. Evolutionary theory was like something like the Earth is flat theory, one of the worst ideas in sort of like science. However, evolutionary theory has controlled all of thinking about aging for the last 100 years. The idea
That's really fundamental.
You're right. The idea of like evolutionary theory, there can't be any genes that can sort of like control aging because aging doesn't have any adaptive value. that was just total nonsense, but that controlled all the ideas. And the only sort of like recently, people have developed computer models. With computer models, they can show the benefit of aging. And basically, to sort of like, and this will just wrap it up in sort of like 2 more minutes about how it's sort of like working. If you so the idea of if you go back 200 million years ago, 200 million years ago, you have a world of reptiles. Reptiles don't have senescence. Reptiles, like a crocodile, they age very, very slowly. So like a 150-year-old crocodile who's still, or 100-year-old crocodile is still very vigorous. At this time, 180 million years ago, you have the development of mammals. Mammals develop senescence. They develop programmed senescence. So the idea of mammals is they were going to have a small number of generations. They were going to have a short lifespan, and then they were going to like have the sort of like animals die due to sort of like programmed aging. And that would have the benefit of pruning the older animals, which didn't have the new genetic variations of the younger animals. So in other words, they would dominate. So older animals would not dominate the gene pool. Since they would die, you'd be making room for the new animals. Their potentially new beneficial genes would dominate the gene pool. Therefore, animals can evolve much, much faster. Once you sort of had the elimination of the dinosaurs 160 million years ago, you can see what happened with mammals, like terrestrial mammals. Terrestrial mammals just took over the whole world because they could evolve so fast, as opposed to reptiles and fish, which are evolving rather slowly. So that was but in order for sort of like the aging to take place, you had to have a built-in mechanism. And it
Yes.
turns out that
Actually, we are really caring about what do you think are the actual mechanism for aging? Does it relate it to mTOR?
The built-in sort of like mechanism was mTOR. mTOR accelerated aging. It accelerated aging in all sorts of different ways. But mTOR, so the idea is that you needed to have a program to accelerate aging. mTOR was the program, and sort of like it turned out that rapamycin blocks mTOR. So it turns out that like by blocking mTOR, you have a marked acceleration of aging. Aging then becomes much slower, and people are not developing the normative changes of aging and not developing age-related diseases.
I was wondering that how many of our body parts are actually influenced by the mTOR?
Say that again.
How many of our body parts or our indicators, our physical health actually are influenced by it?
By mTOR?
Yeah.
mTOR is involved in every cell. So
Every cell.
Yeah, in every cell, mTOR is the command and control of the cell. And you can sort of like look at aging in sort of like all sorts of different the systems. And a real easy the system to look at it is skin. Right? People with skin, like as they get older, universally have deterioration of their skin quality as shown up by having wrinkles. You know, rapamycin stops, like slows down wrinkles. So like you can use topical rapamycin to sort of like slow wrinkles, and they sort of slowed that. Now it's sort of like the skin was very nice to show how it was working when they sort of like used topical rapamycin, and then they did biopsies of the skin. They showed that there was less senescent cells, less chemicals, and sort of like that were being produced by senescent cells, and these less chemicals being produced by senescent cells, they were like, it was resulting in like better quality of skin, a thicker basement membrane, a thicker base of the basement membrane wasn't thinning, so you weren't having sort of deterioration of the skin sort of like quality, you weren't having wrinkles. And so that was showing basically that So they started off, they were just putting topical rapamycin on the skin, but they showed that the effect was decreasing senescent cells and decreasing,
Yeah.
it's decreasing the chemicals that senescent cells are making and preventing the structural breakdown of the skin. So it
And
was
what about organs?
well, and like most of the sort of like organs are sort of like having all sorts of like changes. I mean, the number one sort of like organ deteriorating with age is the brain. Rapamycin is real
Right.
sort of, rapamycin is real effective with that. For one reason, because it appears to be a real effective in preserving the cerebral microvascular circulation, which is like the prime steroid thing for maintaining. In other words, the brain gets, it's only 2% of the body mass. It gets 25% of the energy. It's an extraordinarily high energy system. And it requires an extraordinary amount of high energy for like maintenance and function. So if you're having deterioration of the cerebral microvascular system, you're going to
Mhm.
have, in other words, that results in deterioration. Rapamycin is, that's one of the things that is sort of like stopping. It's like helping to preserve the cerebral microcirculation. But it also, but the general sort of like thing that it's doing for almost all the organs is it's stopping chronic inflammation. In other words, the idea of like inflammation that's not based on a bacterial infection. It's a
Oh,
non-bacterial.
really?
Yeah, in other words, well, like an example is the innate immune system is the thing that brings about chronic inflammation. The innate immune system is basically pattern recognition. It's a system in which, based on the pattern of things, everything looks like a bacteria. In other words, when the molecules like, so an example would be atherosclerosis. Okay, atherosclerosis, I mean, your basic inflammatory disease. So what's going on with atherosclerosis is you start off cholesterol. Cholesterol is like, can get oxidized in the tissues. Now the oxidized cholesterol looks different. The oxidized cholesterol to the sort of like cells that make up the uh, innate immune system, they look like, well, these things look different. They're probably bacteria. We should start up an inflammatory process. And they start off a big inflammatory process, and that's sort of like promoting like coronary artery disease. In other words, sort of like the plaque and the sort of like so forth that's developing. That's the result is this chronic inflammation going on, being triggered by the innate immune system, which underlying this whole thing thinks it's probably dealing with the bacterial infection because the molecules got altered. Right? In other words, rapamycin is stopping the activity of the innate immune system, so it's stopping like coronary artery disease. So like, but this kind of like this kind of inflammatory process of the innate immune system, it drives most of the sort of like age-related diseases. Uh, like that was whether you're talking about like coronary artery disease or you're talking about deterioration of cerebral microvascular system, or whether you're talking about like that was joint disease like osteoarthritis. It's like chronic inflammation is playing a big role. Rapamycin, like the rapamycin stopping that system, stopping the innate immune system, is sort of like stopping all these like things. But you have all sorts of like systems that are like breaking down and deteriorating as people are getting older, and that's basically uh, being slowed. But one of Blagus Sloan's ideas that I agree with is the idea that aging and age-related diseases was the same process. In other words, whether you're looking at sort of like things that would just look like age, like normal changes of aging, or things that were looking like age-related diseases, they were very much the same process. They were both
Well,
sort of like,
talking about the aging related
what?
diseases, I'm wondering that more than 1,000 of your patients have been treated with rapamycin, and how many of them reported significant improvements?
Uh, Generally, most everybody seems to be doing real well
Everybody.
because everybody sort of like wants to get like continue with their treatment. If like people weren't doing well, they would like say, "Oh, I don't notice any improvement." I'm like not going to sort of like continue. People generally sort of like are able to detect that they're doing better. They basically are able to detect that they're aging slower, that they have less aches and pains, that they have like more better mental sharpness, that they detect enough sort of like beneficial things that they continue with treatment. In other words, otherwise, in other words, if you just like took it and then said, "Oh, I didn't feel any different," I was to say, people would stop right away. Nobody stops. The idea that people
Nobody
is
stops.
like want to continue is they're noticing like subtle change. They might be noticing big changes or little changes, but they're generally noticing things that they consider like beneficial. But
And
depending
except
on
for their reporting themselves feelings, based on what criteria or indicators can you make judgments that rapamycin is really effective?
uh,
Everybody.
it depends on sort of like how people are doing, and how the but depending on sort of like how people are doing, people sort of like generally notice that they're doing better. Like I mean, for one thing, people immediately notice that they don't have gingivitis. So as soon as they sort of like notice that, I mean, in other words, that's the first thing people generally notice. They no longer have gingivitis, right? Their gums don't bleed. Their gums have a much better, higher quality. So that's, in other words, they go to the dentist and none of that. That's like one thing they like notice. And people notice less aches and pains. And they notice generally this, a better degree of mental sharpness. But people generally are like noticing, for the most part, people are very, very slow. They like, in other words, they don't have, they have very slow mental like deterioration of aging. But people sort of like notice this. Otherwise, people would continue with treatment. People, and like people sort of like generally can like tell that this sort of it like not there was this fairly like subtle, but they can tell that this are like doing better. Uh, but basically, it's true. It's much more effective with early sort of like changes. In other words, slowing down early changes. It's not a good treatment for end stage disease. It's a treatment of sort of like early sort of like things. In other words, but the early sort of like things involving aging, people definitely notice. In other words, they notice if they're like, and simply like feeling better. I mean, most of the people just take sort of like age-related changes for sort of like for granted. In other words, this sort of like slow deterioration people take for granted because
Then
everyone
what about their physical indicators? I mean, such as that
physical.
insulin or glucose. Do you make measurements about that?
Uh, the only thing I tend to sort of the physical measure things to measure is I like to measure insulin sensitivity. Insulin sensitivity tends to improve. It's like if I
Uh,
measure insulin sensitivity, I measure insulin and glucose and multiply them together, and that gives you an insulin sensitivity score. So that tends to improve. But for but the age-related changes, you know, there's it's just affecting a huge number of different organs. So all sorts of people are coming up with all sorts of different things that they notice. But lots of people will notice enough zero-like things to convince themselves that they're doing better. I mean,
and have you ever witnessed any side effects? Or
side,
if the rapamycin is not appropriate for some patients?
side effects. Did you say that like kind of like side effects? Is that what you said? Oh yeah, the number one side effects is people can have a slightly increased risk of getting a bacterial infection. That's the sort of like, in other words, because rapamycin is turning down the innate immune system. The innate immune system is driving all these age-related diseases, but but it's also the innate immune system is your first line of defense against bacterial infections. So people have a slightly increased risk of having a bacterial infection and a slightly increased risk that a bacterial infection would be a bad infection if you didn't take antibiotics. But I give everybody a prescription for azithromycin, an antibiotic to have on hand. Like half the people never really take it, but some people do have it, and so having an antibiotic on hand is very, very helpful. Generally, if you have an antibiotic, you're better off with where a bacterial infection goes. You're better off having azithromycin and also rapamycin than neither one. So like somebody who's taking rapamycin, that was the idea is that the rapamycin, if they took it on Sunday and you got sick on Monday with some sort of like cough, it'll take a whole week for it to like wear off. But if you take the antibiotic on sort of like Monday, by like Tuesday, you want to remember that you already had anything. You'll be better within a couple of hours. So having an antibiotic on hand works very well. The other thing about antibiotics is the sooner you take them, the quicker they work.
Then facing with all these side effects, what should we do? How can we deal with that?
Say that again.
How could we do to treat or to deal with the side effects?
Oh, well, that's the only side effect. The only real side effect is a bacterial infection. If
Yes.
so, a bacterial infection is something that some people get once a year, some people never get. Some people, like, in other words, if anyone has a bacterial infection, they have to take azithromycin, they get better. That's the end of that. So it's not like, in other words, it's not much of an issue because people have antibiotics on hand. So so for the first one, the side effects tend to, since that's the only real side effect, it's not much, the like side effects tend to be like very, 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 very smart. People get more side effects from most of the other drugs. Like,
Yeah,
I mean,
I agree on that.
somebody taking statins is much more likely to have a side effect of sort of like than someone taking rapamycin. I mean, a good 25% or a third of the patients can't take statins because they get muscle cramps. Almost nobody has like can't take rapamycin. So like rapamycin, the side effects rather infrequent compared to lots of other drugs. And
Yeah,
also,
I totally agree on that.
also, no one seems to have allergic reactions. In other words, it doesn't seem to have off-target effects. In other words, it's not cytotoxic. It doesn't kill cells. So aside from, so basically, it's the sort of like aside from it's just the effect of decreasing the activity of the innate immune system is the main sort of like reason why people have a side effect. And that's just basically like this slightly increased risk that you could get a bacterial infection. On the other hand, there's much less risk of getting, say, a viral infection because it improves the resistance against viral infections. So on balance, it sort of like seems to work pretty good.
Have you ever made any combination of drugs? I mean, make a combination of metformin and rapamycin. Have you ever do that?
I usually use metformin with people who are like insulin resistant. So if people are insulin sensitive, I generally just using rapamycin. If people are insulin resistant, I can include metformin.
Then, actually, according to your theory and practice, the proper anti-aging dose of rapamycin should be 2 to 6 milligram for 1 to 3 weeks.
Yeah, honestly, like maybe I sort of was just starting. As far as my practice now, I'll usually start women on 3 to 4 milligrams, unless there's sort of like more significant diseases, and they start on 6. Men usually start on sort of like 6. So the usual starting dose is 6 although people who are younger might start on 4. So people in their 40s might start on 4. People in their 60s would start on like 6. 4 to 6 is the usual dose, but it sort of like varies with the idea that people have a higher dose if they have more significant disease to be treating, a higher dose if they're older, a higher dose if they're bigger, a higher dose for men, a smaller dose. So like, in other words, a woman who is like 125 pounds, much more likely to, and like 40 years old, much more likely to start on a dose of PEPs, a very low dose of 2. Well, sort of like uh, other people, like bigger people, like older people. And it also depends on what people are treating. The number one sort of like thing that people are people are being treated for and have a higher dose is people who are APOE4 positive. So that's sort of like a major
Recording in progress.
uh so it's like basically I test everybody to see if they're APOE4 carriers. Uh, Basically among my questioners, that's like 25% of the population. Uh, as far as so like 25% of people are like APOE4 positive. That 25% gets the great majority of cases of dementia prior to age 80. People who are not E4 positive generally don't get dementia prior to age 80. So it's real important to know if somebody is E4 positive and to like treat them. And there's also 2 to 3% of people can be double E4 positive. That's very important to like treat them. So that's why with everybody, I like having like testing the APOE type. Uh,
Then should APOE4 carriers take rapamycin at a higher dose and more frequent?
Generally, 6 milligrams is generally okay, but if they're more
Yeah.
likely to start at 6 as opposed to 4. But yeah, so or then they might go up to a higher dose as they then take it for a while. But generally, the APOE4 people, that's a sort of like a prime target to preventing dementia. So that's so like so basically everybody and people sort of like might not have any idea that they like have that because they could be E4 positive, but unless you had 4 grandparents who lived to be sort of like 90 years old and were in good shape, you would not be sure. But if you have parents who sort of like they might die before slightly before 80 and never show up any sort of like issues. So it could be like you might not know unless but if you have anybody in your family, if the family is developing dementia prior to age 80, that's sort of like suspicious.
Well, even though rapamycin is widely recognized as a promising anti-aging drug, there is still a debate about when is the best time to start it.
The best time is sort of like pretty unclear. I usually like I think the best time is from the animal studies. It looks like 40 years old is probably the best time. And
40
that's like
years old?
40. It's not, it was like, in other words, when they were starting like mice, like the equivalent of 40, the mice were living 25% longer. When they were starting at mice, the equivalent of 65, they were
I
living
suppose.
15% longer. So it's not, in other words, 40 seemed to be would be the ideal age, although any age is sort of like good. Although in other words, any age after that is sort of like good. I mean, prior to age 40, people aren't suffering from aging. So it's not that you can't treat a disease if you don't have the disease. And like P5, so I don't think people are like suffering from aging prior to age 40. Therefore, I don't think it does any good to sort of like treat them. I mean, rapamycin is involved in lots of other things besides aging. But as far as like aging itself, I don't think like prior to age sort of like 40, you're not suffering from aging. It's not any advantage to be like treating. And like
Well, there must be so long time for me to take rapamycin.
yeah, also women seem to do very well prior to menopause anyway. So like I think men are deteriorating sort of like sooner. And they can but people can tell how well they're doing if by simply looking at their waistline. If you don't have the same sort of like, I think people, I basically have the idea that people should have the same weight as they had when they were 20 years old. It's like, so as long as people are going along that way and not sort of like putting on any weight or not increasing the waistline, they're usually doing very nicely. It's just about increasing, getting heavier and increasing your waistline. That's driven by mTOR, and that's the first sign that you're developing like age-related issues. Is that when you sort of like have your waistline is getting bigger? I mean, it's a much more prominent issue in the United States where average person is 50 pounds overweight than it's sort of like I think Asians tend to be like frequently much healthier as far as sort of like a good weight.
I also remember that you have mentioned about the rapamycin have helped you to lose weight to 155 pounds, if
Yeah,
I'm not right.
rapamycin is very helpful for losing weight. It's still sort of like difficult to lose weight, but it's mostly very good at maintaining the same sort of like weight. I mean, in other words, I'm like 145 pounds now, so I don't have any trouble maintaining that sort of like weight. Or in other words, so like once you basically mTOR causes people to grow. It's the it's the push of mTOR that's sort of like causing people to, there's a difference between a typical 60-year-old and a typical 20-year-old. A 20-year-old is generally looking, I mean, almost all 20-year-olds are very healthy, and none of them are, very few of them are overweight. They're usually all built in an ideal weight. It's like, but it's like, well, some older people are staying in a good weight. And like, it's very frequent, especially in the United States, for people to be putting on 20 pounds, 40 pounds, 50 pounds. In other words, being like 50 pounds more than they were when they were 20 years old. But when you're 20 years old, you have a lot more muscle anyway. So you lose around 2 to 3% of muscle mass every decade. So people should be getting a little lighter as they
Yeah.
get older. But you can simply tell with a tape measure, people sort of like, in other words, if your sort of like waistline is getting bigger, that's not good.
Then I would like to take myself as an example. I am 26 this year. I want to keep slim, to keep fit, but I am not 40 years old. You have mentioned that the rapamycin started to keep anti-aging. So is that will work for me?
No, you're not suffering from aging now. You're 26. You're perfectly healthy. The idea is that aging was sort of going to kick in at a certain age to promote sort of like deterioration. It was basically in women going to sort of like start after menopause. It's not sort of like going on with you now. So you're not suffering from aging now. There's no reason, in other words, you can't treat a disease that you don't have. It'd be like taking antibiotics for a strep
Yeah,
throat.
I
You
know.
don't have a strep throat. You're not suffering from aging now. Your body is not promoting aging. There's no sort of like, it's not trying, at this point, your body is trying to sort of like keep you healthy. So you're not somebody who needs rapamycin. You're just staying healthy. You're not suffering from aging. Aging is not a sort of like thing that's sort of like kicking in. It's only sort of like programmed to sort of like start later in life. And it's
Yeah, I
definitely,
understand that.
yeah, so it's
Then,
not starting at your age.
then among all these practices before, is there anything that impressed you most? Anything or any case or any patient that impressed you most?
Uh, yeah, all sorts of, I mean, there's just like a wide variety of different people, but all sorts of different, depending upon, but different people have more dramatic improvements. It's also, uh, people do a lot better if they sort of like get a healthy weight. In other words, people who are like overweight and stay overweight don't have nearly the benefits of people who like successfully like try to go on a diet, lose weight, and then maintain a real healthy weight and are insulin sensitive. But see, like people vary a whole lot, but uh, very many people do remarkably well.
Well, thank you about that. Uh, I remember that you have mentioned about big pharma has no interest in generic drugs like rapamycin.
Yeah,
So
right.
it is impossible for them to pour millions of dollars to launch clinical trials. But metformin and rapamycin face the same difficulties in this respect. But hey, pain is on the way, founded through public founding and other.
That's a very, very sort of like localized kind of study. That's sort of like people, in other words, I mean, it's possible for people to raise money on their own. The point is that it's like big pharma, is that in the United States, we're not communists. People are sort of like only sort of promote things if it's in their own financial interest. That's the idea. Big pharma sort of like makes drugs. They're interested in promoting their drugs. They're not interested in promoting someone else's drugs. Nobody is going to spend $200 million to do a clinical study on a drug if it's not their drug. That's not, in other words, the whole thing, the whole idea is set up is the idea that the only good drugs would be new drugs. All sort of like all like beneficial drugs would be new drugs developed by big pharma, and big pharma would spend their money to develop their drugs because it would be in their own interest. It would cost them a few $100 million to do clinical studies, but they'd make $1 billion if they had an accessible drug. That's their business to sort of like develop these drugs, and to spend $200 million on clinical studies is like nothing. But sort of like on the other hand, if it's a generic drug, nobody has a commercial interest in like promoting a generic or doing studies on a generic drug. So people, in other words, they could try to like raise a little bit of money sometimes, but for the most part, it's very, very difficult. In other words, like on rapamycin, the only sort of like study that's sort of like no one has done any studies. The only study, Matt Kablin, is sort of like got a little bit of money, but to do a study. But the study was just sending a questionnaire to my patients, like, how are you doing? And they'd like, you know, write back, like, you know, I'm doing great. It's like, it's like, it's a very low level kind of a study. A real study is, of course, a great deal of money. In other words, and so in like here, in like those big pharma doesn't have the incentive to do that. China would have the incentive to do that because China is not on a for-profit medical system. In other words,
Uh,
if people were living longer, being more productive, not getting diseases, not having sort of like expensive medical care, that would be an advantage for China to sort of like look into something like that. It's not, in other words, well, it's not like they have a for-profit medical system. They're providing sort of like, you know, medical services. And if you're providing medical services, if people did get sick, that would be sort of like good. And if people stayed more productive and didn't get diseases, that would be good. So China would have something that was much more sort of like, you know, from my point of view, motivated to look into this, as opposed to the US system where it's not, it's not beneficial. You know,
yeah, you really get so much knowledge about the Chinese medical market and Chinese medical condition.
yeah, well, I mean, I saw that they had one sort of like study, and they had a very, very nice study from like China, and that they sort of like reviewed all the different things that rapamycin was doing. But the main sort of like I see it is that there was, from China's point of view, promoting good health and people not getting sick is beneficial.
Yeah.
That would, and if they could do it because of the sort of like, they could do it as a small study. In other words, they could simply have like an area of 100,000 people and have them on rapamycin and follow them for 3 years and do a detailed study and see and demonstrate they were doing much better. In other words, they're in a position to sort of like, do that. But these studies now, these real studies take, like a whole lot of money. And someone has to be motivated to want to do it.
And just now, I have received a question from our audience.
Okay.
Is it possible to turn off mTOR thoroughly so that the process of aging will be ceased? Are you willing to ask about that?
I can think you can just sort of like turn it down a little bit, but also there's probably other things involved in aging. mTOR is just one of the things that's driving aging. There's sort of like a lot of the other things going on, but mTOR could certainly be like turned down so it's not at an unhealthy level. In other words, it's sort of like it's a matter of degree. You just want to turn it down into a level so that mTOR is not the thing driving aging. That's it. So it seems like quite possible to turn down mTOR, but it's not clear that that there would be other sort of like age-related things like going on. But you can see as far as aging goes, the people suffering from high mTOR, they're dying. It's sort of like in their 70s and they're getting all sorts of diseases. But there's a few small other people who seem to have very low mTOR, and those are the people who are living to 100 years old and not getting sick. Now, there's developing problems after that, but there certainly is clearly sort of like a large group of people who seem to get extraordinary lack of diseases up until 100 years old. They're just staying at 100, like they're getting like so forth. I think those people have themselves a sort of just low mTOR. So like, being on rapamycin is to try to simulate those kind of like those kind of like people, the people who live to 100 years old and they sort of like are still in good health. It's like, and they seem not getting sick at all. Like they don't have any medical issues. They're just going along very nicely. And rapamycin, so like rapamycin is trying to like simulate people like that, as opposed to the people who, by the time they're in their mid-70s, have like a huge number of age-related conditions that are falling apart. I mean, you can see two very, very different groups of people.
And there are many audiences, they are curious about the use of, for example, rapamycin and melatonin could be taken simultaneously.
I don't know about the melatonin, but I mean, so like how much, I don't know what did you mean metformin?
Melatonin and rapamycin. Could these two drugs be taken simultaneously?
There isn't any contraindication to taking rapamycin with other things. So you can take anything that's sort of like rapamycin isn't interfering with these things. Anything that you think is taking as good, you can take rapamycin with it. But as far as, so like I would say, as far as like people, if you look at the Okinawan population, they were sort of like before, at a certain time, they were basically on a low mTOR kind of program, and that they were very active and they were eating relatively like less calories than they needed. And at one time, they were basically people who were living to frequently 100 years old with very little disease. That was a characteristic of a population that was having very much low mTOR, and that you can see, and for them, they were doing it by having basically 10% caloric restriction. They're eating less calories than they needed, and that was like the world's healthiest population. And then it's sort of like, but after the sort of like later on, after the war, all right, the younger people changed this sort of like lifestyle, and they lost all the health benefits that the older people, older lifestyle has had. So it showed it wasn't a genetic thing. It was the like, it was the like, it was the lifestyle and what they were doing. And basically, they were having a low mTOR. They were having a program to like continuously lower mTOR by continuously eating less.
But could we combine rapamycin with immune boosting drugs or injection?
Uh, I don't know about what are the immune boosting drugs. As far as like, in other words, rapamycin is good for the acquired immune system, and that is sort of like has an anti-aging effect on the innate, on the acquired immune system. People get less viral infections. And as far as so that's that way, it's sort of like it has a sort of like a good effect on that. As far as sort of like I don't know what other immune things you need, but rapamycin is good for the acquired immune system, and that in other words, it's good for T cell function. And as far as sort of like the innate immune system I see is sort of like you don't want to be boosting it. You just want to be, it's just at too high a level. You want to have your innate immune system at a much lower level of activity. You only need it at a higher level if you got broken bones and injuries and infections, but for the most part, you could have it at a much lower level. And so in rapamycin, turning down the innate immune system, that's good. But the acquired immune system, that's of extreme importance. But rapamycin improves that. That's a sort of like T cell function. But sort of like the innate immune cell and system, T cell function, that's of great importance to good health. But rapamycin was being used to decrease that system in transplant patients. So that was the whole sort of like the whole confusing thing about rapamycin. In transplant patients, when it's given every day, it's being used to decrease uh, mTOR2, and it's being used to decrease the acquired immune system T cell function. Those people did not have any benefit. On the other hand, if it's used intermittently, you can, and you use the right dose and the right interval, it's the idea is to try to decrease the innate immune system, mTOR1 functions, but not decreasing mTOR2 functions and the acquired immune system. So it's a case of how you're using it, whether you're using it as they use it in transplant medicine every day, or are you using it like once a week.
Why should rapamycin should be taken intermittently?
Uh, I think intermittently, basically once a week is a good interval.
Once a week.
Yeah, so I experiment with different things, but for the most part, I think once a week seems to work out best. And right now, I like that. And in other words, it's just so what once a week gives you enough sort of like depression of your of like mTOR and for like a short period of time, and it gives you enough time to not be infecting and knocking out mTOR2 and the acquired immune system. So mTOR once a week seems to be a good interval.
Then whether rapamycin has a good effect on female reproductive aging.
Yeah, as far as like women goes, mTOR appears to be the thing that triggers menopause. In other words, so like certain studies have shown that prior to the onset of menopause, the ovaries have a spike in mTOR. The spike in mTOR accelerates the function and essentially like burns out the ovaries. That after you burn out the ovaries, then you have the whole sort of like not making sort of like in other words, now the whole sort of thing is collapsed. The ovaries aren't working. They're sort of like now it's like menopause. Rapamycin and mTOR seems to be the trigger of that. And if you sort of like block mTOR, you would seem to have an effect of slowing down like, postponing menopause and maintaining ovarian function. So I think that way it's sort of like good.
Well, do you have any longevity protocols for yourself? I mean, except for rapamycin, do you take any other supplement?
Uh, Basically, uh, number one is like rapamycin. I also like mag, I also like magnesium. I think maintaining sort of like healthy levels of magnesium is real important. Uh, so you could eat kind of like a lot of spinach or try taking magnesium supplements. And besides from that, I think NAC and glycine is good to try to maintain uh, better glutathione function. But basically, I pretty much rely upon this rapamycin.
And whether rapamycin could be used to treat neurodegenerative diseases with bacteria meningitis.
Oh, say that again. This is like got garbled here.
I mean, whether rapamycin could be used to treat neurodegenerative diseases with bacteria, with that influenced by bacteria.
Oh, so like no, like rapamycin is the opposite of treating bacterial infections. So rapamycin is bad for all the bacterial infections. Rapamycin is decreasing your innate immune system. So for any bacterial infections, you'd have to stop rapamycin and take antibiotics. It's not good. It's definitely not good for bacterial infections. Not good for yeast infections. Not good for say like probably protozoa infections. All those type of things that require your innate immune system. Rapamycin is not good for that. But it doesn't sort of like interfere with T cell function, so it's good for sort of like viral infections.
Well, let's come to the last question. That at the end of this interview, what do you want to say to the Chinese anti-aging community, or what do you think that is the future development of Chinese anti-aging industry?
Yeah, it's a very, very good. Rapamycin is basically, I think, it's the most important new drug since antibiotics were introduced 90 years ago. So it's an extraordinarily valuable drug. It's a drug that can simply like revolutionize the health of older people in their like middle ages. And for a place like China, it can have extraordinary value in that it'd be real simple to be like making it available to middle aged people, and they like demonstrate people were having a lot less age-related diseases, a lot slower down aging, and a lot better productivity in older people. It's something that fits in for like China. It fits in with the Chinese system very, very, very well. In other words, you're not having a for-profit medical system, and like maintaining people in good health and not getting sick and being more productive would be extraordinarily good for like from China's point of view. As in other words, so they, uh, that's why I think it has. I think it's like China is the most likely country to sort of like use rapamycin and then demonstrate, oh yeah, we use rapamycin in like a few 100,000 people. We followed them for a few years and they did very nicely. Like in other words, China is like I would think so if rapamycin is going to be introduced into like general use, China is the most likely country that would do that because they have like nothing was they have all this sort of like ability to you know to look at it like that as opposed to like there was there was the United States where it's just sort of like just certain people who like find it's totally outside of the usual medical system. In China, it can be part of the medical system, not something outside of it.
Thank you so much. But it is a pity that we might come to an end to this interview. So thank you so much about your insightful and fruitful arguments, as well as the medical advices for our audiences. Thank you so much.
Okay, good, thanks. Okay, okay, bye.